Hello and welcome to the MISD Mandatory Coaches Training. In this course we will discuss anaphylaxis and EpiPens, asthma and inhalers, and House Bill 984 and how it pertains to diabetes. Let's get started. We will begin discussing severe allergy action, known as anaphylaxis. With anaphylaxis, always remember when 2 or more body systems are involved, give the AP. If you give AP, call 911.
If you or your child has been prescribed EpiPen, or if someone you know has severe allergies, it's important that you learn how to use EpiPen correctly. That way, you can feel more confident and prepared in the event of a severe allergic reaction. In the case of an allergic emergency, every second counts. That's why it's so important to always have easy access to EpiPen and to use it at the first sign or symptom of a severe allergic reaction. Here's how. EpiPen is administered in 2 simple steps. Grasp the EpiPen autoinjector with the orange tip pointing downward. Blue to the sky. Remove the blue safety cap by pulling straight up. Do not bend or twist it. Orange to the thigh. Place the orange tip against the middle of the outer thigh.
Push hard against the leg until you hear a pop, which signals that the injection has started.
Count slowly. 1, 2, 3. EpiPen will work through clothing if necessary. After EpiPen is used, the orange needle cover will automatically extend over the needle. This safely covers the needle as the autoinjector is pulled away from the thigh. You will not see the needle before, during, or after use. Do not try to reuse EpiPen or EpiPen Jr. after the device has been activated. Remember that using EpiPen does not replace seeing a doctor or going to the hospital. So call 911 or go to the emergency room right after using EpiPen. Remember that the effects of epinephrine can wear off, or a second reaction could occur. If symptoms continue or get worse, you can use another EpiPen or EpiPen Jr. 5 to 15 minutes after the first dose. That's why you may want to have more than one EpiPen autoinjector handy. However, more than 2 sequential doses should only be given under direct medical supervision.
Neffy is a nasal spray used for emergency treatment of allergic reactions, including anaphylaxis, in adults and children aged 4 years and older who weigh 33 pounds or greater. Each Neffy contains a single dose of epinephrine. Always carry 2 Neffy nasal spray devices with you. Keep Neffy with its instructions until ready for use. Use Neffy right away, as soon as you notice symptoms of an allergic reaction. Remove Neffy from the packaging and hold the device with your thumb on the bottom of the plunger and a finger on either side of the nozzle. Insert the nozzle into a nostril until your fingers touch your nose. Keep the nozzle straight into the nose, pointed toward your forehead. Do not point or angle the nozzle to the nasal septum, which is the wall between your 2 nostrils, or the outer wall of the nose. Press plunger up firmly until it snaps up and sprays liquid into the nostril. Check for symptoms after the first dose of Neffy. If symptoms get worse or come back after 5 minutes, give a second dose of Neffy in the same nostril starting 5 minutes after the first dose. Get emergency medical help for further treatment of the allergic emergency or anaphylaxis if needed.
Now let's discuss assisting those with asthma and what an asthma action plan looks like. With any action plan, follow the doctor's orders. Inhalers can be used prophylactically. Also listen to them. If they say they need their inhaler, believe them. Now let's discuss Texas House Bill 984. House Bill 984 requires each school in which a student with diabetes is enrolled to meet certain standards. One standard is for school employees, such as coaches, who are not healthcare professionals, to serve as UDCAs and care for students with diabetes. They should be able to identify a student who has diabetes, identify potential emergencies, and an appropriate response in regards to diabetes. They can check and/or monitor blood sugar levels, administer insulin according to their treatment plan. They can also help manage low and high sugar levels quickly while performing this care in a classroom or any other school setting. So what is diabetes? Diabetes is a chronic, long-lasting health condition that affects how your body turns food into energy, according to the CDC. Insulin is a hormone produced by the pancreas and helps the body convert food into energy. In diabetes, the pancreas does not make insulin, or the body cannot use the insulin properly. This can cause the blood sugar to be too high or too low. Diabetes cannot be cured, only managed. Diabetics must carefully balance food, medications, and activity levels to keep the blood sugar level as close to normal as possible. Diabetics need regular meals and snacks according to their care plan. Things that can affect blood glucose are exercise, illness, tests, and field trips. Signs of low blood glucose are shaking, sweating, fast heartbeat, hunger, headache, dizziness, anxiousness, weakness, and fatigue. Signs of high blood glucose include extreme thirst, blurred vision, drowsiness, hunger, decreased healing, and frequent urination. Here is a sample diabetic treatment plan. It is multiple pages long. This plan from the doctor outlines low and high blood glucose levels and what to do and how much insulin/carbs to give and when. This is a sample quick reference emergency plan. This is a quick and easy way for the nurse, teacher, and coaches know what to do by utilizing helpful algorithms. Next item to discuss is how to check a blood sugar level together. Wear gloves for this procedure. First, you will use a lancing device to poke the tip of a finger on a clean hand. Wipe first drop of blood away with an alcohol pad. Squeeze the finger to get a drop of blood. When blood drop is ready, put testing strip into glucometer and touch the test strip to the edge of the blood drop. You will see the glucometer begin to read the sample. Clean the finger. Next is checking for ketones. After they have urinated on the ketone strip, compare the color of the strip on chart located on the bottle of ketone strips. Results will be read as negative, small, moderate, or large. Record results in students' diabetes log and treat accordingly to IHP/. To help with treatment of mild hypoglycemia, start by checking the blood sugar. If it's below 70, give small fruit juice, regular soda, glucose tablets, and lifesavers. Observe for 10 minutes, then retest and retreat if necessary. After the second treatment, call parents and nurse for further instructions. Can administer glucose gel if needed. When do you provide emergency assistance to someone with diabetes? Look for these emergency symptoms. Symptoms include confusion, slurred speech, seizures, and unconsciousness. If you find a diabetic student unconscious and/or seizing, you need to open the airway by opening their mouth, head tilt, chin lift. Then call 911. Test the student's blood sugar. If it's below 70, turn student on his/her side. Administer glucose gel and glucagon. Call the parent and school nurse. Provide support and monitor until EMS arrives. If you give glucagon, you are also calling 911. To administer, you will remove the cap, inject the liquid from the syringe into the powder of the vial, then swirl or roll medication, being careful not to shake. Then withdraw the medication from the syringe. Remove bubbles and inject. Thank you. Please contact your campus nurse if you have any additional questions.